Hi, Dr. Hamjay. Would you mind if I
Okay.
examine your abdomen? I'm just going to have a look from the end of the bed. If you take a deep breath in and out. Deep breath in and out. Deep breath in and out. That's fine. Okay, if I could have a look at your hands, please. Okay, and turn over. Okay. Okay. Put your hands up and cock the wrists back and hold it there. Okay. And you can put your hands down. Great. If you could look up for me, please. Okay. And show me your tongue. Yeah, and pop your tongue up. Okay. And if you could just show me your gums. Excellent. Okay. I'm just going to press around your neck. Okay. And I'm just going to have a look at your right. Okay. Is there any pain in the abdomen? Do you mind if I touch? Okay. I'm going to press a bit more deeply now. You take some deep breaths in and out for me. Okay, good. And again, some deep breaths in and out. So I'm just going to press a bit more deeply. Take some deep breaths in and out. Okay, and again from this side. Okay, I'm just going to press a bit more deeply and press around the back. Thanks. Okay, so I'm now just going to go and tap on your abdomen. So I'm just going to tap across the abdomen, and then I want you to roll over to your right. Yep. Okay, and turn over this way. It's okay. You okay? Yep. Okay, and you can, while you're there, I just want to press a bit more deeply in your stomach. So you put your arm across here. Okay, and I'm just going to, again, try pressing here. Take some deep breaths in and out. And if you want to lie back down. Okay, I'm just going to listen with my stethoscope now. And then just want to have a look at. Okay, and lastly, I just want to have a look at the fistula. If you could just turn over to your left.
Okay.
Okay. That's the end of the examination, and thank you for your time.
Thank you very much.
Yep. So on inspection of the hands, one sees that there are some nail changes, particularly mild nail dystrophy in the thumbs. Also, on inspection, you can obviously see a large AV fistula in the left arm. On the right side of the chest, there are some scars, which are from previous permacaths for hemodialysis. Inspection of the face shows that there is some fat atrophy or lipodystrophy. And examination of the abdomen, the first thing one sees is a right iliac fossa, large right iliac fossa scar. And on palpation, there is a renal transplant in that right iliac fossa. Examination of the fistula shows that it is quite large. There are no needle marks suggesting that this has not been used recently. And across the left forearm, one can see lots of papillomas and warts, and examination of the gums, could you show me the gums, shows some gingival hyperplasia. And don't forget looking at the medic alert necklace, which the examiner may stop you looking at, but it tells you what the problem is there. So to complete this examination, I would like to examine the hernial orifices, the external genitalia, and do a PR examination. I would also like to know what is the urine dipstick. Okay. So this young man looks comfortable at rest. He has a functioning left forearm AV fistula. There are scars across his right iliac fossa and across the upper right side of his chest, and across his face one can see fat loss suggesting lipoatrophy. And on palpation of the abdomen, there is a right iliac fossa mass, which is dull to percussion and suggests the presence of a right iliac fossa renal transplant. So in summary, this man has a right iliac fossa renal transplant for end-stage renal disease, for which he has previously been on hemodialysis, and the possible causes include mesangiocapillary glomerulonephritis associated with lipoatrophy. The AV fistula is not being used as there is no puncture marks. So what is important to do in this case is to comment on the obvious positive findings, but also important negatives, such as saying that the AV fistula is functioning and that it is not being used, as one cannot see any fresh needle marks. Other findings on the examination would include ankle edema and absence of organomegaly, but it is not necessary to comment on those things.